The PC2000 provides patient-controlled non-narcotic local pain relief. It is simple in design and function. First, remove the cap on the fill port and attach a 60 cc syringe filled with 50 cc of a local anesthetic, such as 0.25% bupivacaine. Next, inject the 50 cc of the local anesthetic into the fluid reservoir. Detach the syringe and reapply the protective cap to the fill port. Attach the tube extension set to the PC2000 at the outflow port labeled cath. To purge the unit of trapped air, first turn the PainCare upside down. At that point, depress the blue button twice. On the first depression, the spring-loaded syringe will fill with 4 cc of local anesthetic. The second depression will prime the system. Catheter placement is crucial for optimal pain relief. The catheter must be placed at the source of pain. To place the catheter, first insert the catheter insertion needle through the skin and into the wound site. Remove the introducer needle from the insertion catheter. Next, insert the marked end of the 16-gauge catheter through the hub of the insertion catheter and into the wound site. Remove the insertion catheter while holding the catheter tube tightly in place. When using the multi-port catheter, all catheter markings should be below the surface of the skin. Next, assure the catheter placement in the wound site by strain relieving it with any appropriate tape or dressing. Attach the catheter connector to the catheter by inserting the free end of the catheter into the connector cap. Tighten the cap until the catheter cannot be removed from the connector. A sufficient loading dose of local anesthetic is necessary for the PainCare to be effective. The 4 cc maintenance dose will not be effective without the loading dose. After the wounds are closed, attach a 60 cc syringe filled with an appropriate volume of local anesthetic to the catheter connector. Inject the medication into the wound site. Finally, attach the catheter to the PC2000. To do this, attach the Luer lock catheter connector of the 16-gauge catheter to the free end of the tube extension set by twisting until secure. Depress the blue button one time to ensure proper flow of medication. The patient must be instructed to push the button once every 4 to 6 hours. Once the dressings are applied, attach the PainCare using the metal clip to the dressings, brace, or sling. Some procedures require infusion of 2 sites for adequate pain relief. For ACL reconstructions, using the patellar tendon as a graft, the Y adapter makes dual infusion possible. One catheter is placed into the joint and the other is placed at the graft site. Depression of the button blasts medicine into both areas at the same time. Subacromial decompressions with open rotator cuff repairs also requires dual infusion. In this case, the one catheter is placed in the subacromial space, where the acromioplasty and debridement is performed. The second catheter is placed into the wound site through which the rotator cuff is repaired. The Y adapter permits medication to perfuse to both painful areas. The PainCare 2000L employs a lockout. A flow restrictor between the 50 cc fluid reservoir and 4 cc spring-loaded syringe provides a 30-minute delay in filling of the syringe. This prevents the patient from rapidly dispensing the medication. Bregg's PainCare line of products provide a simple, portable, effective, and inexpensive method of local wound site pain relief.